After BSc Zoology, why you choose medical coding as your career?
I chose medical coding as my career because it has a great demand. Also, it ensures a great career in the very early age. Also, we know that AI has taken place most of the job opportunities, but as a human coders are very essential for the accuracy.
Very good.
I would like to explain the system, nervous system.
Okay.
Nervous system is one of the important system in our human body. Nervous system along with the endocrine system perform all the functions of our human body. Nervous system is divided into parts like central nervous system and peripheral nervous
Which are
system.
the parts of central nervous system?
Brain and
The
spinal
structural
cord
and functional unit of nervous system is called?
is called the neuron.
Okay. Axon is covered by?
Myelin
Myelin
sheath.
sheath is made up of?
Schwann cells.
What are the functions of myelin sheath?
Protection.
Acceleration and
Protection.
insulation.
Insulation.
Okay. Then autonomic nervous system again divided into?
Sympathetic and parasympathetic.
What is parasympathetic?
Parasympathetic nervous system calms our body.
Respiratory system.
Respiratory system is one of the most important system in our human body. It is divided into two portions, upper respiratory tract and inner respiratory tract.
Larynx also known as?
Voice box.
Also known as?
Adam's apple.
Okay, it contains vocal cord and it
Yes.
helps for sound production.
Producing.
Okay. Trachea is made up of?
Trachea is made up of highly
What is
C-shaped
bronchial tree?
bronchial tree. The trachea is divided into two, that is right bronchi and left bronchi. Again it is divided into primary bronchi, secondary bronchi and tertiary bronchi, then ends with the bronchioles, then finally into the alveoli, sac-like structure for gases.
Okay, abdominal cavity and thoracic cavity is separated by a dome-shaped
Diaphragm.
structure called a diaphragm. Very good. Example for any endocrine gland and hormone producer from it and its function.
Okay, thymus gland is produces thymosin.
What is function?
Function provide immunity.
Okay,
It is also
then
known as
pancreas
glucagon.
contain islet of Langerhans.
Yes.
Which are the two hormones, main hormones produced from
Insulin
islet?
and glucagon.
What is the function of glucagon?
Glucagon increases the blood sugar level.
Very good. Okay, then last question from anatomy part. What is the function of tympanic membrane?
Tympanic membrane is also known as
Eardrum.
eardrum. It converts the sound energy into mechanical energy.
Okay, very good. From ICD guideline part, briefly explain about anemia related guideline.
Okay, if a patient comes with anemia due to neoplasm, primary code should be for the neoplasm, then secondary code for the anemia.
How to define neoplasm?
Neoplasm is the abnormal and uncontrolled division of cells.
Okay, what is the difference between carcinoma in situ and benign?
Benign is the non-spreading cancer, and carcinoma is confined into the origin site.
Okay, what is the term metastasis stands for?
Metastasis is the cancer spreading from one site to another site.
Chapter 15 stands for?
Pregnancy,
Any guideline
childbirth,
from
and
that chapter?
15 have priorities, sequencing priority over all other chapters.
Very good. What is the term perinatal period indicate?
Perinatal period is the period immediately before the birth and after the birth following 28 days.
Differentiate between B20 and Z21.
B20 is coded for HIV and Z21 is coded for asymptomatic HIV.
Very good. ESRD stands for?
End stage renal disease.
GERD.
Gastroesophageal reflux disease.
COPD.
COPD stands for chronic obstructive pulmonary
VAP.
disease. VAP stands for ventilator associated pneumonia.
UTI stands for?
Urinary tract infection.
Very good. Okay, the last question from ICD guideline part. Patient have multiple burn in different site. How we will report?
First, primary code should be for the highest degree of the burn. Then
Okay, then classification of the pressure ulcer based on severity.
stage 1, stage 2, stage 3
What is the
and
difference
stage
between
4.
stage 3
1,
and stage 4? Stage 3
Okay.
and stage 4.
Stage 3, full thickness skin loss. Then stage 4 is necrosis, also affecting the bones.
Okay, very good.